Hello again, everyone. This is our RG3 injury update. Like I said we would do. We're just going to spend a little bit of time on exactly how RG3 got injured. Let's begin. All right, so this is 2009 where RG3 played at Baylor in Texas, and which he had his first injury in 2009. So let's take a look exactly how he got injured. So as you can see, RG3 is on the option, and as you can see from the defense, he gets hit by number 2. And as you can see his knee is injured. This is the first ACL injury that he had. As you can see, obviously is in pain. So that's from 2009. So this is week 14, 2012. So let's take a look at the second injury. And as you can see, he is hit by number 92 of the defense. He plays on the Ravens. So as you can see, his knee is flailed in the air, and number 92 comes down on it pretty hard. So let's go to the third injury that he had. And this is the playoff injury versus the Seahawks, when RG3 misses a bad snap and bad field conditions leads to his tearing of the LCL and ACL. His injury is so bad he doesn't even try to recover the ball, so it must be a pretty bad injury. So just another angle, as you can see. Snaps his ACL, LCL. Alright, so let's talk about the injury. RG3's injury versus the Seahawks resulted in the lateral collateral ligament tear, or the LCL, and the ACL, or the anterior cruciate ligament tear. So let's talk about a little bit of knee anatomy, not to jog it down, but the lateral collateral ligament, it pretty much runs from your femur or the thigh bone to the tibia or the shin bone, and it's going to prevent the lateral or the sideways movement of the knee. So as you can see, let's go real quick. RG3's knee, because of the compromising of the lateral collateral ligament, you see how it comes out to the side. It's not supposed to do that naturally. So that's what the ACL prepares. And the ACL is a anterior cruciate ligament. It connects the femur to the tibia, and it limits the rotation in the forward movement of the tibia. And the tibia, another word is that is just shin bone. So let's talk about the injury analysis. It's pretty much an ACL tear and an LCL tear. And as I spoke of before, the ACL is pretty much going to prevent rotation and a moving of the tibia forward, and the LCL is going to pretty much prevent lateral or the side-to-side movement. So when talking the ACL, you're going to talk about diagnosis. The diagnosis is by MRI, and as you can see on the left here, you have a normal knee anatomy, and on the right you have a torn ACL. And so based on the doctor's description and the diagnosis, you'll be able to see the diagnosis and the tear on what's known as an MRI. For the LCL, it's a little different. It's usually, from what I research, it's usually a grade. You have usually grade 1, grade 2, and grade 3. Grade 1, you have a little bit of tenderness, no minor pain at the point of injury, maybe small tear. Grade 2, noticeable looseness in the knee. If you move it to the side, it's going to be about 5 millimeters in terms of the open space of the knee. And grade 3, you're going to have considerable pain, tenderness, inner side of the joint. Now, if you open it up, you're going to see it pretty much half an inch when it's moved, and that's a little more serious. So that's why it's grade 1, grade 2, and grade 3. Based on what I saw, not to diagnose, but from what I saw, it's most likely a grade 2 or a grade 3 injury. So this is a little bit of a it's an animation based on what a ACL reconstruction surgery looks like. So as you can see, he had a tear, and so they're gonna have to reconstruct it. So this is just a little animation. So what they do is they take they're gonna take a tendon from this is the patella, that's the tibia. So they're gonna take a tendon from which is the patella tendon from the kneecap here and the tibia, and it's usually about 10 centimeters in length. So you're not gonna spend too much time on it. After they take it, they're gonna suture it back together, the patella tendon, in order to regain the strength of the knee. So after they suture it back together, you're going to see that this is the graft here. They're going to analyze it, and sometimes what they do is, based on my experiences in surgery, they're going to tailor the size of it, and they're going to put it in a measurement apparatus, and it's going to be used in order to put inside the knee. Then they're going to use what is known as a camera. The whole thing is called arthroscopy, not to jog you down any details that are maybe boring, but it's going to be able to see inside of the knee. That's the point of all this. So to see inside of the knee. Let's go a little forward here. So you can see pretty much on the camera. You're going to want to be able to see inside the joint. And as you can see, that's going to be the ACL right here, which is going to be used in order to reattach it or to reconstruct it. So let's move forward a little bit more. So this is another one, and this is like a shaver. And what that does, it pretty much gets rid of any kind of loose cartilage that may be causing pain. So they're going to get rid of any cartilage, anything that's going to prevent healing, they're going to get rid of. Just forward a little bit more. So this is interesting. What they're going to do is they're going to take a drill, and they're going to drill it from the other underside of the tibia, and they're going to drill it through where the ACL is supposed to be. But because of the injury, it may be torn, and they're going to pretty much replace it. And this is going to be the place where they're going to drill it to. And not to bore you, but just kind of move it forward a little bit more. And so they're going to do an over drilling with another a bigger size drill, and they're gonna it's going to come through this hole where the patellar tendon graft is going to fit in. As you can see here, that's the over drilling that I was talking about. And then they're going to put what's known as interference screws. And as they take the patellar tendon and they put it through, they're going to use what's known as a interference screw, and they're going to pretty much suture it inside of it and make sure that it doesn't move anywhere. They're going to drill it, and they're going to actually screw it inside. So as you can see, this is exactly what they're doing. They're pulling the patellar tendon through, and that's going to be they're going to hold it in those two places. Put a interference screw inside of it in order to secure it so it won't move anywhere. Let's move forward a little bit more. And it's pretty much that's pretty much the operation. So this is a live operation. Just just to give you a little bit of a idea of what they do live. That's what's known as that's pretty much as mark. They're going to use that in order to drain all the blood from the lower leg, and that's pretty much going to be used. And they're going to put a tourniquet, get rid of all anything that may obstruct the area, so you can see clearly on the screen. And they're going to do the same thing that you saw in the animation, where they're going to put cameras, and they're going to put the probes in it, and they're pretty much going to see the anatomy of the knee joint based on what I showed you earlier. That's going to be a probe. That's the ACL that's torn, and that's what they're going to use to reconstruct it. It's actually really interesting. So they're going to take a shaver, and they're going to drill. They're going to shave anything out of there that's going to prevent any kind of healing. And just to kind of move forward, I'm not going to jog you down on any details. A shaver again there. All right, and they use the suture, as you can see in the middle screen, to suture some portion of the ACL that they were able to salvage. And so now they're going to tie down that area. Now, what they're using in this particular operation is an Achilles tendon in order to use the ACL reconstruction. You can use the ACL, you can use a Achilles tendon, you can also use a patellar tendon like I saw, or you can use a hamstring tendon. So it really depends on the surgeon's preference and based on what he thinks is best. So as you can see here, they're just tying the tendon together in order to make it more useful and to fit better. More drilling here, and now this is where I want you to see they're going to drill the hole like I showed you earlier, in which you're going to put a hole through the femur, and they're going to put an oversized hole in order to make sure that the graft can fit properly. So let's fast forward again even more, and they're going to drill from the tibia side also. And that's the oversized drilling. And I want you to see, this is exactly where they're going to, now they're pulling the graft through in order to fit properly, exactly like you can see here, the same place where it's supposed to. And now they're going to use the interference screw in order to secure the ACL to the femur and onto the tibia. This is exactly what it looks like in real surgery. All right, and so that's the new graft, the new tendon. It's going to pretty much be used in order to keep the knee from dislocating or moving in a way it's not supposed to move. And now they're just going to close the skin layers, and that's the end of the operation. And then they follow it up with physical therapy. Now that was the ACL. Now this is the LCL. I want to show you a little bit of that in surgery, because like I said, all of this is what RGIII went through. Alright, so the LCL injury, pretty much you're going to see it can be done a little bit either arthroscopically. Some people do it open. Most likely it's going to be open since it's really close to the skin. And as you can see here, let's go back here. Apologize for that. But like I said earlier, as you can see here, you have they actually took this particular one from the hamstring graft. And so when I talked about interference screws, which is going to keep the tendon in place so it's not moving all around, that's exactly what they do. So they put the interference screw here, and then they have a tendon here. It's almost like a triangle shape, and that's going to use it to recreate the fibular collateral ligament, or what's known as the lateral collateral ligament. And that's going to keep the knee joint from moving side to side in a way it's not supposed to move. So as you can see here, you're just checking to see whether it's done, whether it's all is good. Put the interference screw there again. Check it out again on the arthroscopy monitor. Check everything out. Close the skin level, and then we're done. So let's talk about the prognosis based on what the doctor of the team physician of the Washington Redskins said. Dr. James Andrews on January 8, 2013 said Robert Griffin III had a successful knee surgery early this morning. He had direct repair of his LCL, which we talked about, and a redo of his previous ACL reconstruction. We expected full recovery, and it is everybody's hope and belief that due to Robert's high motivation, he'll be ready for the 2013 season. And that's Dr. James Andrews of the Washington Redskins. And a little bit of a humor here, but a little bit of word of wisdom to RG3 from Michael Vick. Robert, you got to learn to slide dog. All right, so that's pretty much our ACL and LCL reconstruction surgery.